3, 1, 4, 4, 1, 5, 7, 1, 7, 7, 1, 8. Chuck, we have now finished the exam that we discussed earlier, and Erica now has some numbers that she is going to give you some information which I think you'll find interesting. We have implemented a new scoring system in our office that really predicts how long you can keep your teeth if you have our treatment done and follow the recommendations later. And so what I'm going to do, I'm going to ask her to score numbers 15 and 19, and I'm going to go check Jennifer, the hygienist, and I'll be back in a few minutes.
Okay.
Now Chuck, if you just give me 1 minute, I'm going to calculate your scores and then we can discuss what they mean.
Okay.
Because your age is over 40, you score 1. Because you smoke greater than 1 pack a day, you get a score of 4. You're not diabetic. The type of molar for number 15 gives you a score of 2. The probing depth or the severity of the disease for 15 gives you a score of 2, and for 19 a score of 1. You don't have furcation involvement or looseness of those teeth. For 15 your score is a 9, and number 19 your score is a 6.
Is that 9 out of 10?
It is, but it might not be as bad as it seems. Smoking has a great impact on the severity of the disease, and therefore if you decrease the smoking, you get rid of 4 points, and the survival rate for 15 years is much greater.
Wow, that's a big difference. I'll try. I've been smoking a long time, but
Let me go get Dr. Miller and he can explain it to you a little bit better.
okay.
Well, Chuck, did what Erica mentioned about the scoring system make sense?
Yeah, it does.
All right. How about that smoking factor?
I didn't realize it was that critical, but I'm gonna try and do better.
Okay. Now, you score, I think it was a 9 on number 15 and a 6 on number 19. Now, in percentage-wise, what does that score mean to Chuck?
Well, a score of 9 means a 75% survival rate and a 45% 30-year survival rate. A score of 6 means a 90% survival rate of 15 years and a 74% 30-year survival rate. But since smoking adds 4 points into the factor, if he could quit smoking, that would significantly lower his score and raise the survival rate of the teeth.
Right. Now, what about that? If we lower the score from a 9 to a 5 and you quit smoking, what would be the percentage rate of his keeping his teeth for 15 years?
For 15 years, he'd have a 93% survival rate.
Now, you see what an impact smoking can have. Now, on number 19, because of the root structure being different down there, that just scores a 6. And if we eliminate the pockets that are there and get that score down from a 6 and you stop smoking down to a 2, what would be the success rate for 15 years if it gets it down to a 2?
It'd be 97%.
That's virtually 100%, Chuck. So we see how impactful smoking can be. Now, I'm going to ask Erica to review how you're cleaning and perhaps show you a little more effective way, an easier way to floss, and also to check your brushing habits to see how well you're doing. Then I'm going to have you meet my treatment coordinator who will go over your insurance, sequence of appointments, and things like that. Now, do you have any questions?
How long does it take for the smoking the effect of the smoking to get better on my gums?
The smoking effect by stopping is almost instantaneous. So we do not have to delay treatment necessarily, but do start working on the smoking.
Okay.
All right, before I leave, I want to dictate a letter to your referring dentist, Dr. David Ivey, and kind of give him an idea of where we're going. And I'm going to send you a copy of this letter because I know you'll want to look it over before you get involved with treatment. Now, if you have any questions about this letter or anything else, Erica is well trained on answering questions and all, so don't hesitate to call her. She'll give you a card, and also we have something really significant. This is a sheet of 5 things that are the criteria for success, which gives you a formula to look at on studying this. Now listen, if you will. This letter goes to Dr. David Ivey. Dear David, thank you for the opportunity of seeing Chuck Long and the confidence shown in me by referring this patient. I would confirm your diagnosis of a localized general severe periodontitis, especially in the molar areas. Period. I have reviewed with Chuck some of the things that we're doing on Prognosis, and he has an excellent prognosis if he can stop smoking. I did note that on tooth number 30 he had a badly broken down amalgam, which certainly you will want to put a crown on once we're through. As soon as we get tissue maturity, I will get him back to you to evaluate that tooth and any other restorative needs, and if satisfactory with you, we will alternate recalls. Thanks again for this nice referral. Any questions before I leave?
No, no.
Oh, one more thing, Chuck.
Yeah.
You remember the 5 criteria for success that Dr. Miller mentioned?
Yes.
Since you are not a diabetic, you only have to worry about 4 of them.
Okay, great. Well, that was certainly a lot easier way to floss you showed me. Thank you.
Well, I'm glad I could help.
That was
Let me
great.
take you over to the treatment coordinator, and she can get everything set up for you.
Okay, thanks.
Hi, Mr. Long.
Hi,
I'm Jennifer.
nice to meet you.
Nice to meet you. I'm going to be doing your cleaning today, okay?
Okay,
How have you been?
fine, thank you.
Good. So first, we're just going to take a look around and see how you've been doing and what kind of job you've been doing keeping those teeth clean.
Okay.
Okay?
All right.
Okay, so let's see how you're doing. Okay, overall it seems like you're doing a really good job keeping your teeth clean, but there are a few areas you're still missing around your molars. But we can talk about all that and things that you can do to improve after we do your cleaning. Okay?
All right.
How's it coming with the smoking?
I'm down to half a pack a day.
Are you?
Yep.
That's great. Good for you. Because by doing that, you've taken 2 points off your score.
Wow, so if I quit completely,
You'd take another 2, so that'd be a
Okay.
total of 4 points off your score.
okay,
All
I'm
right?
trying.
Yeah,
I'm trying.
keep trying.
Okay.
Now let's take a look at that area where Dr. Miller did that surgery. We'll see how you're doing. I'm going to take some probing depths. Okay, well on this molar, before you had been probing 7 millimeters, and now you're probing 5. So that's another 2 points off your score.
Great,
Yeah.
great.
So if we keep cleaning really well, keep cutting back on the smoking, and as that area heals, I think your score is going to get better and better. Okay?
Okay,
All right, well let's then go ahead and get you cleaned up.
okay, sounds good.